In terms of HIV, we are not comfortable with the current levels of HIV that we have. We are also not comfortable with the current levels of sexually transmitted infections that we have.
On Guam, there have been 592 cases of chlamydia reported per 100,000 people. That makes Guam the 8th highest in the nation for the STI. At a workshop held last week, Monitoring and Evaluation Officer Secretariat of the Pacific, Dr. Olayinka Ajayi, says it's critical to address this alarming statistic.
Bearing in mind that HIV itself is a type of sexually transmitted infection, when the rates of ordinary sexually transmitted infections are high, like we are seeing in chlamydia, we are also not comfortable with what might happen in terms of HIV because they have the same factors.
But how to address such issues? Dr. Ajayi says the workshop helped set strategies for the next 5 years, from 2014 to 2018, a plan that includes not just public health, but partnering non-governmental organizations, the military, and other health bureaus.
One of the things that is important in the dynamics of doing that is the need for us to set strategies that are sound in themselves, as well as the ability to monitor the progress of implementations to see whether we are doing what we're supposed to be doing, whether we are doing them well, and whether we are achieving our objectives as intended. The limited amount of resources we have must be directed at the most effective interventions and the most effective ways of going around them.
Dr. Ajayi says intensive strategies need to be directed to the community while being sensitive to the island's culture as well as respect the society's values.
We have an engaging healthcare workforce, and we also have an engaging partners coming from non-health that are supporting the healthcare workforce in order for everybody to work together to really make the health processes in Guam to be better, make access to be much easier, and to be much more sensitive to the real needs of the population.
Health check.